The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Dr. Tom Roselle Live and Ageless Health live stream. Yours truly. And guess what? Thank you for listening a few minutes ago on WMAL 105.9. We got into the depths of a little conversation, and we're going to expand upon that right now. We're going to be talking about diagnostic considerations of what happens when your joint spaces start breaking down and start destroying themselves. So the question becomes, you go to the doctor, right? And you have all this joint pain. Your hands are killing you, your wrists hurt, your shoulders hurt, your knees hurt, and it's kind of random. And they tell you, well, you have autoimmune osteoarthritis, degenerative joint disease. So how do you know in the early stages that that's taking place? How do you get a red flag that said, I better do something about this now? Is this really taking place to me, or is it something else? Well, we're going to get more in depth into this incredible diagnostic tool called thermographic imaging, thermography. Now, we belong to ACCT, the American College of Thermographic Imaging and so forth, lightly explained, but we want to get into the depths of this. So here's the deal. If you go to the doc and said you got rheumatoid arthritis and they didn't even do a blood test, or you've got degenerative osteoarthritis and they really didn't follow up or anything else. And they said, take this steroid, take this anti-inflammatory, take this, whatever it is, this for that type of situation. You've heard me say that 1,000 times. So how do you move in a direction, one, to really know that your joints are involved or it's something else, meaning muscles aren't working the way they're supposed to. You have a pinched nerve in your neck or your shoulders or your low back, someplace like that, which is, if you go to the right source, meaning us, thermographic imaging, you got it together and you can get it fixed. But let's get into the piece of it. So you're hurting and, you don't know what to do. So let's talk about the beginning stage of this stuff. So thermography, remember we said what thermography is? It's a camera that takes a picture of heat changes in the body, anywhere, whether it's in the breast, ladies, and it'll show up the blood supply 3 to 8 years before you develop a breast tumor. Wouldn't it be nice to know that before it even gets to the place of saying, well, this is cancer? Now you can do something perhaps much more gently and naturally to resolve it, to turn things around. I don't know about you, but it sounds like a really good idea to me. Now, how about, the other pieces, a thyroid problem, but we're talking about joints. It's still something that has to, if you've got pain, there's going to be heat signal with it. So thermography is a valuable tool, incredibly valuable tool of identifying joint dysfunction that has a heat signal to it, inflammatory reaction. So when you start looking at body systems, like all of us, thermography has been shown it can be extraordinarily effective, much more so than any other diagnostic in finger pointing to this inflammatory something that's going on in the joint. So you got identification. Yes, there's a problem there. So we know we take it the next step. So recent, if you will, advancements in thermographic cameras and imaging and so forth have provided the ability to detect minimal, small temperature changes, and it aids in the diagnosis of joint inflammation, because sometimes that joint inflammation is subtle. When you touch the joint, you really don't feel a lot. Well, maybe I hallucinated something, but is it circulatory? You get more blood supply to one side of your body than the other. That's not a good thing either, by the way. But here's the deal. So when we look at a technology that, one, is non-invasive, doesn't have any side effects, it's not radiation, it's low cost comparatively to all these other things, and it provides objective measurements of joint surface temperatures. joint surface temperatures. And it can help finger point, if you will, the causes and what's happening to that joint. You combine that system, that thermographic imaging, with things like ultrasound and blood work and so forth, and you can skip the invasive diagnostic CAT scans and MRIs and X-rays and so forth that we know can cause a damage, right? So these findings, these highlighting things, these finger pointing with a thermographic diagnosis is extraordinarily valuable. As we go through here, I want to show you something, and I don't know how well this will come across, but I want to show you something that is an indicator. So you might be able to see this. I'm going to bring it close to the camera. The first picture is of a knee, right? And you see that hot red area here. And that tells us that we have inflammation. Now, this is a beginning, and this is an end treatment process that we did in the office, and then we put it on this pamphlet in our thermography department. But this is sequential over about a half hour. So we start here with an inflammatory reaction in the joint. Yep, we got a problem. Patient was complaining that they couldn't bend their knee. They were having a difficult time going upstairs. So we wanted to see if we could do something about it. And we started using acupuncture and laser therapy. And guess what happened? Here's the deal. It changed. So we knew that we could alter that. We could affect it significantly. So when you're dealing with thermographic imaging that basically is recording a heat aberration, a heat abnormality in the joint, and now you say, okay, I've got this, let's see what works. And then you can tell immediately, sometimes within an hour, if it's working or not. Isn't that cool? That's amazing. So if you have joint space problems, you have to make sure that that in fact it's there and it's inflammatory. Maybe it's destructive. Maybe there's a viral pattern in there that's destroyed it. Epstein-Barr virus loves to live in cartilage in the joints. Now, here's the deal. Since I mentioned that, do you know that if you had the COVID vaccine, that it increases your risk of accentuating, potentially activating other underlying viral patterns that you have inside of you? Epstein-Barr, cytomegalovirus, herpetic patterns, and so forth. And all of a sudden they show up, out of, oh my God, nowhere. Well, this is a way of detecting it. This is a way of showing that there might be a problem. So we want you to be aware that this is an amazing diagnostic tool, and we make use of it at the Roselle Center, and all the pieces of diagnosis that we don't need to use that are destructive to the system. Now, I want to remind you, coming up in just a very short period of time, September 17th, in-house presentation at the Roselle Center in Fairfax. Dareth Painter, the principal of Thermography Centers of Fairfax, and also we're blessed to have her here in the office with us on a day-to-day basis, is going to be presenting Seeing Beyond the Surface with thermography and really understanding what this is. We're going to show you the cameras. We're going to demonstrate it. We're going to show you what happens. We're going to ask questions, and we're going to answer the questions, right? So join us. It's September the 17th at 6 p.m. at the Roselle Center for Healing. All you have to do is go to drtomroselle.com or rosellecare.com. It's right there in front of you. All you got to do is put that in, click the button, and go register. Or if you want to do it the old-fashioned way, it's real simple. 703-698-7117, 703-698-7117. Join us. I promise you're going to get a ton of data, lots of information, and it's going to be, one that you can use and say, oh, wow, this is really there. Or, I don't see the inflammation in the joint space. It's coming from someplace else. Or here's the other thing, right? If you have it here, where's it coming from? Was it directly related to the shoulder because of an injury or bad positional pattern? Or was it coming from your neck and the nerve that comes from here that goes directly into the shoulder muscles? Now, the muscles aren't working the way they're supposed to. So now you end up with joint space dysfunction leading to joint space damage. Now, we know there's things like rheumatoid arthritis, right? And rheumatoid patterns generally are autoimmune, but they start in the intestinal system. So you can take a picture of the joint and you can take a picture of the gut and see if there's inflammatory reactions in both areas. It will show it. It'll finger point it. Now, if you know that's true, there's very succinct and very specific ways of resolving and altering all kinds of things. That night, the 17th of September, is going to be a really important night for all of us, and being able to show you what's possible without huge medical expenses, without huge medical intervention, with all kinds of autoimmune suppressive drugs, with all kinds of steroids, which make things far worse over a period of time. By the way, did you ever think why, you go into professional sports over a period of many years, and they used to, somebody gets hurt on the field or on the court or whatever it is, and they would inject them, they juice them, they give them the needle, and they get back on. What they were doing is they were injecting a steroid into the joint space, which drops the inflammatory level down, so the pain is tolerable. Because so much pain, most pain, has at least a minimal, most of them, a significant level of inflammatory reactions. So that steroid injection, that oral prednisone, that dose pack that you take over a period of time, knocks out the inflammation temporarily, but it does it at an expense of destroying the joint even further over a period of time. So if you know it's there, you know it's inflammatory, wouldn't it be better to know exactly where it's coming from? Could be the wrist, but the wrist is bothering you because the muscles of the wrist aren't working the way they're supposed to. And it could be because your neck is out of position, or the elbow is not working the way it's supposed to, or there's a strain reaction all the way down into the chain from the biceps or the profundus muscle in the forearm here, and then causing problems in the wrist. So every time you do this, the range of motion is limited, but it hurts. It's deep. It's been there for a period of time. So you begin to find the pieces of the puzzle and put them together. That's why thermographic imaging is such an amazing tool. And we use it on a regular basis to really put things together. There was an interesting article that came out from PubMed, one of my favorite go-to places to investigate. But you got to read all the stuff, not just one article. You got to go through and really put together. And it was an article that said infrared thermography for the evaluation of inflammatory and degenerative joint disease. And they called it a systematic review. And so what they found is that inflammatory pathways is the central finger pointing of rheumatic diseases, rheumatic degenerative joint diseases, and so forth. And so the temperature basically can be quantified. It can be measured and provides a tremendous amount of data information about the level of destruction that's going on within that joint space. So if that's the case, wow, what an amazing tool that you can use. So, when you read through this article that was published, and I'll give you the finger pointing in just a second, the review of the literature shows a tremendous amount of medical interest, if you will, in technology that our world, the natural world, has been using and known about forever. And its applications in different joints that are affected by, if you will, inflammatory reactions and degenerative pathologies. So infrared thermography has proved to be simple, extraordinarily accurate, non-invasive, and no radiation. So if that's the case, and it's really that good as a diagnostic tool, why in God's name are we not using it in every situation, from osteoarthritis and degenerative joint disease, and it affects all the joint spaces, the articular area. It shows inflammation within the bursa, the synovial sac, if you will, that buffers the joint from rubbing on itself. And it shows that there might be, something that you have to go after. Then you pair it up with what the laboratory work, and you see shifts in the white blood cell, which says maybe we have, a bacterial infection. Maybe we have, something that wasn't picked up. But instead of going through all of this crazy, and chasing tail and say, well, we're going to do this, then we're going to draw a sample of the fluid out, and then we're going to do this, and we're going to. I don't know about you, but osteoarthritis and rheumatoid is a major cause of disability. And if you understood exactly where it's coming from and you understood how to upregulate immunological function, and you know that inflammation plays a central role in these pathophysiologies, we'll call it that, uh, specifically rheumatoid conditions. Instead of losing your joints and they become gnarled and bent and deformed and so forth, if you can find it early on, wow, what a home run you've got. So we're going to cover that. We're going to make sure that we go through that on the 17th. It's going to be a really cool presentation. I promise you that you're going to learn a whole lot about that. So when you go through, here's the deal. You got to identify. So we have to look at the history, the case of the patient, right? Everybody is different. You come from different areas. You grew up differently. You eat different sorts of junk, if you will. I say that lovingly because this country's got the worst food in the world unless you're really going out of your way to eat organic and non-GMO. And by the way, try it sometimes. You may find that you're going to feel a heck of a lot better just doing something like that. And if that's the case, by the way, try this. I'm off topic a little bit. No, I'm not. I'm still on topic. If you know you have inflammatory something, and you're living on medications, and you're on a walker, or you're on a cane, or you're on, you even, God forbid, you're in a wheelchair. Why don't you try something by changing your dietary habits for 30 days? So what do I want you to do? And a lot of you go, oh my God, I can't do that. I'll die first. Well, let me tell you what I want you to do. I want you to drink only filtered water. Number one. And I want you to drink, you can have a little green tea. You can have a little herbal tea if you know you're not allergic to it. But get off the caffeines, the full cup of pot of coffee you have every day. Get off of the heavy black teas and so forth. Drink a little green tea, tons of water, half of your body weight in ounces. So if you weigh 145 pounds, 150 pounds, you should be getting about 70 ounces of water every day. Yeah, I know you're going to say, I got to go to the bathroom. Well, if you do it slowly and then add a little Celtic salt, a Baja salt, or a pink salt, every time, just a pinch, every time you drink it, you're going to find that things are going to be really good shape. Now, do that and then only eat foods that are organic, non-GMO. Get the gluten out, get rid of the dairy products, tons of vegetables, berries, and leave it at that. Strawberries, blueberries, raspberries, blackberries, things like that. A little bit of that, no sugar on top of it. Dump the sugar. And I'll make you a deal. I promise you, if you did that for 30 days, you're going to find that your whole body is going to change exponentially. I promise you. I know that I'm right. And if that's the case, now, wouldn't you like to get function back? Then that's when you're going to call us. You're going to call the Roselle Center. And you're either going to come and see us or give us a call. By the way, did you know you could get a courtesy consultation, from one of my doctors, about 15, 20 minutes, just asking them questions. You call the office at 703-698-7117 and say, hey, listen, I'd like to talk to one of you guys and see if this is something that can benefit me. They'll do that. They'll get on the phone with you. I promise you. These guys are amazing. They're great doctors. We've handpicked them. They have all kinds of technical skills that most people in the healthcare arena don't have. And we're not talking about injections. We're not talking about IV drips. We're talking about taking your biophysiology and making a difference with them. Things that will drop that inflammatory reaction down to virtually nothing. It's important. It's important you understand that things are reversible. Did you know that even joint spaces that are kind of totally shot, you can make a difference in them? And wouldn't it be nice maybe if you're on a walker that now maybe you only can have a cane to assist you a little bit? Or maybe if you're on a cane and you're finding it difficult to go up or down stairs, that you can make a difference. Well, we can figure out if it's an inflammatory response simply by doing a thermographic diagnostic with you. So let's get into that a little bit for you on the 17th. I promise you're going to be impressed. It's one of the most effective tools that you will ever use to save yourself, to help yourself, to make a difference in your life. Wouldn't it be nice to recapture it? So 17th, put it down, call us, register. The only thing that we ask you for these classes is a very simple, straight up process, right? Register for the class. If you can make it, we'll see you. If you can't make us, call us day before. Just say, hey, something's come up. I can't do it. And, we'll let you know what we can do to help you get the information. If you listen to my program on WMAL 105.9 FM in the Washington metropolitan area, if you're watching our Asia's Health live stream on a weekly basis, and if you want to see the other ones, by the way, go to drtomroselle.com. And if you go up into the toolbar on the right-hand side, you're going to see podcasts and live stream. And click it, and you're going to see tons and tons of information up there. I think the radio programs go back, I don't know, decades, if you will. We've been on the air for 27 years in public radio. And the live stream episodes that are up there are about everything. We've been doing them now for quite some time. We're going to start doing more things on a regular basis too. By the way, if you haven't followed me on Facebook, Instagram, Rumble, X, and so forth, we're all over the place. So get that done so you can follow me no matter what we do, where we go, and you're getting data information. We're out there. I'm teaching all over the place. I've just been invited to go to El Salvador in November to attend an international conference on functional biological medicine. I've been asked to present. Haven't decided if I'm going to go, but I'm really tempted. I want to go. We'll let you know because I'm going to come back with a ton of data, a ton of information that maybe I didn't know. There are things that can be said outside this country that can't be said here in this country without somebody coming down with impunity and really beating you up for it. So join me on an ongoing basis. Follow me on live stream. Follow me on Instagram. Follow me on Facebook. And we'll make it happen for you. I promise. And by the way, if you haven't gone to our store on drtomroselle.com or rosellecare.com, get it done. It's called ageshealthstore.com. And the office, you go into, the office store as well. We've got all kinds of little stuff in there for you. We've got water filters, and we have things that increase your nitric oxide production. We have autoimmune support systems and so forth. Make it happen. And if there's anything that you want, anything that I can do for you, it's real simple. You can get a hold of me. If you're watching me on this program, you can send us a note. You can say, hey, listen, I need to know something about this. And let me know what you want to know about. I'm happy to do it for you on an ongoing basis. Life is about being the best version of yourself that you possibly can become all the time. So you can enjoy the process. But remember, in thermographic imaging, when we're talking about how things show up, if you got some damage in your hands, it'll show. If you have a loss of circulatory pattern, it'll show. If something's going on in your head, neck, and shoulders, it will show. And it shows increased heat resistance. And sometimes at the bottom of the area, there's not enough circulation. You see that dark area? See that blackness? That means the blood supply is very limited. And guess what? You remember everybody says a lot of dementia, old age dementia is because circulatory pattern is not there. Sometimes it'll show up just like that. And now there's steps that can be taken to increase the blood supply, increase the functional capacity, and all of a sudden you're back to where you should be. Isn't that cool? I don't know about you, but these are one of the things I use for myself on an annual basis. I go in and say, Dareth, I said, all right, see what you see. And she looks at me and she says, what did you do? I said, and that's with me getting treated because I get chiropractic care and acupuncture care and on an ongoing basis. And I sleep with my nutritionist, and that's my wife. I try to keep myself as best shape as I possibly can. So join us on September 17th. We'll get it done. I promise you're going to have tons of data. If you're not in the area and you're not close to the Roselle Center, I will give you referrals of who does great work, in natural and integrative therapeutics. I'm teaching all the time. I'm teaching all over the world. So let me know. we're coming down to the tail end of the program, and I want you to know that I'm always here for you to answer any questions that you may have. All you got to do is reach out. You could go through the office at rosellecare.com, and I'll get back to you, I promise. You can do it through this site as well. You can through drtomroselle.com. But let us know what you want, and I'll make it happen. Remember, I do this on an ongoing basis for one reason. Besides the fact that you deserve the data, you need to make your own choices in health. But simply this, I love you all. You have a great day. Talk to you soon. Bye.